Good morning. Welcome to the Board of Water and Power Commissioners meeting. Today is Tuesday, December 29th. This proceeding is broadcast on Channel 35. The exact broadcast times can be found by contacting Channel 35. General Counsel?
Good morning. This is a special meeting of the Board of Water and Power Commissioners, and in accordance with Governor Newsom's order of March of this year, this board meeting is being conducted remotely. Also, consistent with that order, public comment will be conducted remotely. Members of the public wishing to offer any comment on the items on today's special agenda may call 213-306-3065. Again, that's 213-306-3065. And when prompted, please enter 146-792-6504. Again, 146-792-6504. You will have 2 minutes to speak on the item. Please turn down your phones and please turn down your computers so that we don't get any feedback. With that, I turn it back over to you, Madam Secretary.
I will be conducting roll call. Commissioners, please say present. Commissioner Lair?
Present.
President McLean-Hill?
Present.
Vice President Reyes?
Present.
Commissioner Neiman-Brady?
Present.
Commissioner Berard is absent. 4 members present and a quorum. Opening of the board meeting by President McLean-Hill.
I just have very brief opening statement. First, I want to thank the commissioners for being available to gather for this special board meeting. This meeting is focused primarily or exclusively on our COVID response, at least as it relates to our open session. The department, as I'm certain y'all are aware, has had an alarming increase in reported COVID cases. We have, as a board, heard a number of informal presentations regarding the department's response. Those presentations or those comments often revolved around telecommuting and things of that nature. The board vice president and I asked the department's general manager and leadership to prepare and present to this board a COVID response plan focused not simply on telecommuting, but also detailing our response as it relates to essential workers in field-related jobs that do not have the opportunity to telecommute. And that is what is being presented today. We believe that this is a matter of extreme and critical importance, and look forward to the presentation and to the review and input from this commission. With that, I will go back to our secretary, at which point I assume we're opening public comment.
President McLean-Hill, we have no public comment. All public comment is now closed.
Thank you very much. I appreciate that. Then, Marty, I will turn the floor to you for the presentation of management reports, agendas items 2A and 2B.
Great. Thank you very much. Can everybody hear me okay? I think I have a different speaker that I'm using. So is it working okay?
Working great.
Great. Thank you. So we have a presentation laid out about what our COVID response plan is and modifications that we've made to implement a broad testing protocol available to our employees and other changes, as well as touching upon the rollout of vaccinations. And so I'll lead off just briefly to kind of set the stage, and I'll turn it over to Nazir Fosley, who is our Director of Corporate Safety, who is now managing our COVID response. So with that, I guess Lindsay has the slides. We can see the first slide, please, Greg. So just to remind the board that the department is viewed as a we're critical infrastructure workers. We're an essential function of society. If you look at every aspect of the government, federal, state, and local has deemed us as a critical business. And so our approach through everything we've done has always been to, no matter what tier we've been in as far as what's going on in the world around us, we've always remained open with modifications. So our approach is that we have always had to keep our critical functions going. That's not always just folks in the field in terms of water and power delivery, but also many of the office functions, the support functions that allow work to continue, whether it's providing materials, whether it's paying employees, whether it's mailing in your customers and sending out bills, and there's a whole range of functions that are critical to keep the utility going. All those have continued with modifications that I've spoken about before in terms of telecommuting and other things that we've done. But we are exempt from many of the rules that are facing other businesses because of the nature of our business. So our goal has been to conduct our business in a safest manner as possible to make sure that we can deliver for the people of Los Angeles and at the same time keep our employees' health and welfare first and foremost. Next slide. So just as you've seen, this is a tracking of cases that we see in the area versus cases at the department. You can see that just for the board's information, we have tracked very closely with what's going on in the world around us. And so probably the most shocking piece that we're all aware of is what's happened in November and then December. Probably stemming a lot from Thanksgiving holiday and now what we're looking, what would probably logically, unfortunately, happen after Christmas holiday. So we are seeing cases rise. We've had a considerable number of cases, over half our cases, and we'll look at that in a second, but have been in the last 2 months of what we had early on. And so this is also necessitated changes to our policies and our practice, not just the policies, but our practices and what we're doing, because the caseload that we're dealing with here amongst our employees in terms of keeping our workforce safe, what we need to do is change dramatically in response to this growth. But we are reflecting the world around us. Next slide. Just to cap what we have done so far, many of this you've heard before, just to recap. So, early on, we started actively encouraging sick employees to stay home. We did this by changing our sick policy to a paid administrative leave policy so that people had no reason to come to work sick. And so we have been sending employees home who are sick. We've encouraged people not to come to the workplace who are sick. We've had daily health checks. We asked employees to check their own health. We have at times had checks upon people entering facilities. We have engineer administrative controls, which are the structural things we've talked about, plexiglass, hand washing stations, things that are hard fixes to protect employee safety. We do take action in cases suspected or confirmed COVID infections, and the zero get into the details about that. And then we've done a lot to educate employees about protecting themselves. One of the challenges that Joe Romalo will get into at the end is also about outreaching those messages to all employees and trying to dramatically improve the reach of those messages and how we make sure that everyone is hearing what we have to say. Next slide. And so just my last slide before I turn it over to Nazir. Just early on what we did, so initially in March 2020, we had we didn't really call it a task force. It was a working task force that dealt with employee health, protective equipment, and facility issues. At that point, an expanded senior staff meeting occurred every morning until it got to where we were kind of hit a steady state. So we probably went for about 2 months meeting every morning and creating the team that would go through the decisions, realizing that everything we were doing was the first time for anybody. So learning and trying to look at what was going on around us. The CAO has been the lead of this effort up till recently. Myself, other senior staff members, and facilities director have all been part of this. We are continually evolving our response. One of the things that is And as you saw, the increase in cases has called for somewhat of a revamping of our response to protect our employees. We transitioned the lead on this to corporate health and safety. Nazir, who heads up that area, who will be reporting next, is now in charge of this. The timing, I wish I'd made that transition, honestly, about a month prior, because the transition from the CAO to corporate health and safety, where we were getting an issue where we had to do regular reporting of cases, regular communications to employees, things that fell very directly in a lot of the things in the kind of communications that they would normally handle. So that transition happened, and then shortly, almost immediately after that happened, we were hit with the first spike in cases. And so there's been a little bit difficult in transition because a lot got set upon Nazir's shoulders at a very bad time. And so we've had to do some scrambling and play some catch up to revamp. But that transition was made, and I think we're situated for the long haul. And then we're also revamping the task force. We have our medical director, Dr. Leslie Israel, is more directly involved in decisions that we're making and in our policies, an active part of the task force now, as well as Nazir's group, the resource office, and myself. And we'll also be growing with some more representatives from the systems, recognizing that we have to have someone who has the horsepower in the organization to make decisions at the same time. There's a lot of work for the senior AGMs to be doing that they have to deal with on a daily basis. So trying to get the right representation to make sure we have active involvement without overwhelming the people who are already pretty heavily tasked right now. And then we are adding a new position, a coordinator of testing. This became very apparent during the last several days when we ramped up the amount of testing that we have available. The testing that we are actually going to aggressively push out to employees. Mr. Mike Whitting, who is part of our facilities group, who came from I was going to say ISS, PCM recently, is a very sharp manager, detail-oriented, and extremely well-organized, who will be leading and coordinating the effort of all the testing that we will be rolling out to our facilities and to our employees. So Mike is coming on board to do that so that it doesn't fall directly under your shoulders with the overall efforts that we're making. So at this point, first of all, I do want to acknowledge the CAO, Linda Lee, has done a tremendous job in working on this since March and the effort. And we've transitioned the work to corporate health and safety now under Nazir and his team, as well as transition the resource office to that area. And Linda continues to be involved and consult as necessary, but we're trying to get her back to other duties and find a long-term home for this effort, especially at the level of effort that it's taking right now. So with that, Nazir, I'll turn it over to you to continue the report.
Good morning, Commissioners. This is Nazir Fazli, Chief Safety Officer. I'm here today to report to you the plans of LADWPs to protect its employees during COVID pandemic. Next slide, please. To ensure the safety and health of our workforce, we have implemented a number of control measures. All of these control measures are in alignment with guidelines from Centers for Diseases Control, as well as California Public Department of Health, County Public Department of Health, and meets and exceeds requirements of CalOSHA. One of these control measures was development and implementation of a comprehensive exposure control plan. So this exposure control plan includes guidance for employees to self-assess and self-check before they come to work, guidance for employees to clean and disinfect their personal workspaces, guidance for custodians to clean and disinfect frequently used spaces, guidance for cleaning and disinfection of areas that are associated with positive cases, guidelines for employees to interact with people outside of our general public, inside the department facilities as well as outside the department, guidance for employees using department vehicles, and as well as requirements, number of requirements for employees to maintain social distancing, physical distancing from each other, using the mask, face covering, using the face covering properly, as well as requirement for employees to receive a training. This training was developed by corporate safety, and all employees were required or are required to have had the training when returning to work or when they are at work. And we delivered the training through Cornerstone and recorded, documented, make sure that all employees receive that training. Next slide, please. So I want to get into our current status. As we know, the beginning of month of December, we had a sharp, very rapid, sharp increase in the number of cases that positive cases here in LADWP. To date, from the beginning of the pandemic, we've had 605 employees that have tested positive for COVID-19. Of those, 322 of them, more than half, has been since beginning of month of December. And during this month, or currently on paid administrative leave, we have 202 employees that are on paid administrative leave. 112 of them have tested positive, and 90 of them are on admin leave because they were close contacts. I just want to share something else that is not part of that slide. It's that, the number of close contacts for power systems. So up to date, we have 375 cases, or from power system, joint system, there are 134, and water system, there are 78 cases to date. So as Marty mentioned, the responsibilities of resource office functionally was transferred to corporate safety. They have a matrix reporting to corporate safety. Administratively, they still report to CEO's office, but functionally on everyday activities, we will be working together through corporate safety. And this is to better coordinate worksite outbreaks. Outbreaks are a new definition that Cal OSHA, they just adopted their emergency temporary standards. In it, they have a definition for an outbreak, which is whenever we have 3 or more cases of positive at a workspace where employees report at certain facility, then that facility or that workspace is considered an outbreak or exposed workspace. And we're required to test everybody else who report to work, and they have to use that workspace. Then we have to test them once a week for 14 days. So in other words, we have to test it twice as long as there's no other cases during that 14-day period. And if we experience another positive case during that 14-day period, then the time starts all over again, and we have to continuously test our employees once a week until we have 14 days with no new positive cases. Next slide, please. So I want to cover another control measure that we have, and it's very effective. That's the implementation of paid administrative leave that allows us to isolate and quarantine employees who are experiencing symptoms of coronavirus or any respiratory infection that is similar to coronavirus. We were able to isolate them from workforces to control the further transmission. Also, admin leave applies to, of course, any exposures, whether the exposure happens in DWP workspace or outside of department. Anybody who has been exposed to coronavirus, they will be isolated or quarantined from workspace. And of course, that applies to tested positive cases. When they are positive, then they're isolated from work. Next slide, please. Contact tracing is a function of resource office. Our resource office identifies the positive case, they provide necessary information, and they conduct a contact tracing. In other words, they interview the positive case based on the information they gather from the positive case. They determine who has been close contacts to that positive. And proactively, we isolate those positive close contacts just to make sure that they are not infected and they further transmit the coronavirus at workplace. So the definition of a close contact is, the criteria for a close contact is 15 minutes of cumulative within 6 foot of a positive case in a 24-hour period. So we achieve it. We determine positive cases through a series of questions that we ask the person who is positive to determine who are the close contacts to that individual. And we remove those individuals from workspace. Next slide, please. So the antigen test is also called a rapid test. In other words, these tests are given and the results are given back within 20 or 30 minutes. It is a fast, rapid test, but the accuracy is not as good as PCR tests. In other words, even if we have a positive case determined or identified through rapid test, we have to corroborate that with a PCR test. In other words, when we test individuals and they test positive using a rapid test method, then we will send them or provide them a PCR test kit to confirm that positive test. So the way we are going to be using these rapid tests is just being proactive. We target employees who are working in operations that are critical to operations of department. In other words, if there's any disruption in these within these groups, it will have a significant impact for Water and Power to provide services to our customers. So we will proactively test these groups weekly and biweekly to make sure we identify positive tests as quick as possible and do a contact tracing to make sure that we identify all close contacts and isolate those from workspaces.
So I'm sorry, just Najir, when will this begin?
This will begin as soon as we procure the rapid test kits. We are working right now on a contract, and this is a GM signed contract, less than $5 million. So as soon as we have these kits on site, our test coordinator will be in charge of conducting these weekly and bi-weekly testing. So I anticipate this should be not too long, maybe within a week or so.
I need a date. Could somebody tell me when this will begin?
Yes, so we did the first test of this last week at the Power Trouble Board, where we had a number of cases. And if you're familiar with Power Trouble for the board members, it's an office where there's a number of employees in an enclosed environment. There is some physical separation, but the risk of exposure, someone could get sick and potentially expose all the rest of the staff. So we did this last week and did the first test there. There's another test that was set up for this morning. We do have one vendor we're working with. We're adding a second vendor who has greater testing capability. This afternoon, we'll be identifying, confirming with Water and Power Systems the regular weekly locations, which I expect will be Power Trouble, ECC, Filtration Plant Control Room, potentially Water Quality Lab. And then there's extra capacity above the number of employees at those facilities. And so the bi-weekly is we would rotate this rapid testing through other critical work groups. Maybe there's not the exposure risk, maybe they're outdoor employees, So to be people who are responsible for the people who actually respond to power lines that are down, respond to water mains.
So will we have the test available next week or the week after next? Nazir did not seem to know.
We'll be testing. We anticipate that we'll be testing next week. We may not be testing at all the facilities next week, but we'll continue to test at power trouble where we have an ongoing issue, and we will continue to ramp up next week with additional rapid tests. And I don't anticipate we'll do any more this week, but by next week we'll be increasing the rapid testing to get to a steady state of facilities that we visit each week, within some random spot checks every other week. I mean, in between those with the extra capacity. And I think the capacity is about 400 tests per week that we're able to do. We may be able to exceed that, but currently we're looking at a testing capacity of about 400 tests.
And Nazir, you mentioned a testing coordinator. Is that testing coordinator staff already on board?
We have, or Marty can speak on that.
Yeah, so this is one of the things that we found a deficiency, because we had, too few people trying to do too many things, and so in order to keep that, really control the testing, because we have Aaron Henning has been working very closely with us, as well as Fisher Woodward, for getting contracts available. But we didn't want to be in a situation where the systems felt that they had to fill the gaps and not be coordinated centrally. And so Mike Wooding is going to be acting as our testing coordinator. And so he will be coordinating both with the vendors and the facility managers, because we also have to make sure that all the employees are notified to come in, because of the way we're running shifts. We want to make sure that we get as many people in to be tested as possible, and we have a complete list of names. So there's a meeting following this meeting with system heads to firm up the exact frequency and locations for where we'll be doing the rapid testing. So, but it was apparent that we needed someone whose sole purpose was to focus on this area, and so that will start. And we have contracts in place. It's a matter of just making sure that we're now using those in a very, very deliberate fashion, and I believe we'll be doing probably pretty extensive rapid testing next week.
And is that person part of Nazir's team and coordinating with Nazir? Because it still seems like you've got a very fragmented, lots of different people who are, so how is this working?
So he'll be working directly with Nazir on this effort. So Nazir is still overall responsible for the overall effort, but in terms of focusing on the detail of the testing, the facility managers, vendors, contracts, this person will be working directly with Nazir on that, but focusing on this particular aspect.
And reporting to whom?
And the person the person normally reports in the facilities. In this effort, the person will be reporting to Nazir, and also as well as coordinating with Dr. Israel about testing and outreach, and looking at potential groups that need to be offered testing that we identified. So this will be a coordinated effort, but be working through corporate health and safety office.
Okay, thank you.
Next slide, please. Okay, these are all the testing that we will have available, different types of testing that are going to be available. And first, there's going to be testing available, partnering with Los Angeles Fire Department, that they will be coming to the DWP facilities and performing the test. And this is going to be one location per week. The January 7th, the location is going to be JFB. January 14th will be Truesdale, and they can test up to 200 employees per week, per session. And so we will be, these tests will be available for all employees, but we will definitely target.
Hi, it's Nicole. Just so how long is a session, or what is that span?
there's 200 tests per location per day or per week rather. So when they set up, for example, at JFB, they can test 200 employees that day. It's just in one day they can test 200 employees. These are PCR tests. In other words, they collect sample, and the sample will be sent to a lab, and the results will be available between 24 to 48 hours. So these are not rapid tests. These are, but the sample collection is done by fire department.
Okay, and that's a work day. That's a one day when they can do 200. That's a typical work day. Those are the hours. I'm just trying to get a sense of the timing.
Correct. What time will they be coming, and when and how long will they stay? I think is what she's trying to understand.
I recall 12 to 4 is as seen as Linda. Correct me if I'm wrong. Is the hours 12 to 4 o'clock?
That's what's scheduled for January 7th. It's here in the JFB, and it will be 12 to 4. There's a PCR code of one of those barcodes that we sent out, so that all employees will have an opportunity to click on the link and register to take the test. And so we're meeting this afternoon and work through the protocols on how they can sign up for the test, how we're going to send it out to everybody, how they're going to line up, and all that to ensure that there's distancing and we meet all the requirements while we're doing it.
To clarify, the first testing is here at JFB. It's not for JFB necessarily. It's just that all the downtown yards have construction around them and difficult access. So this is being used as a location where it can be done. We also needed an indoor ability for enough indoor space to do the testing, but also provide spacing for people. So this is used as a location, not because of JFB focus. So it's just a downtown location, and of course, there's adequate parking for people coming from the field. And then we'll have the Valley location, and then we're identifying a third location with the idea that these would continue every Thursday. There'd be at one of these three locations, first 3 Thursdays a month, and then and that's how we would do this. And then Nazir, I'll let you continue because I know you have the other 500.
And I'm sorry, and this is first, just really quickly, this is a first come first serve testing process, or how is this being coordinated with our employees?
Yeah, so, and Linda, you jump in, but yeah, so because of the way the testing is run, you actually have to click on a link to register for it. And so the difficulty is that the employee has to do something and have to have access. So this is the thing we have to work through, because obviously someone sitting in an office with a computer has immediate access. Someone who's working in the field may not get to it till later, or may not see the email till later. So we're looking at both, how we distribute the notice about testing as a way of making sure that we hit targeted audience as need be, and also what we can do to assist to make sure that everyone is having an opportunity to sign up for the testing. But this is the kind of testing that you could theoretically get on your own, but we're trying to offer it on site here to employees so we can more actively push out testing.
Okay, thank you.
Linda or Nazir, do you want to add to that? Because I know that's one of the details we're working out, is how to make sure that everyone has a fair shot at getting the testing.
Correct. We will have other choices also. We are working, we are partnering with fire department again, and we will be giving 500 kits. These are kits from fire department. These kits will require us to have some trained personnel to basically not administer the test, but provide the test to our employees. So we will be testing, our fire department will be training our employees first week of January, and after our employees are trained, then we will receive up to 500 kits from fire department every week. So we will use those to target all of those other facilities that we talked about earlier, to make sure that we test all of our, proactively test groups that we need to identify in a quick manner any positive case among employees. In addition to that, we also have, currently we just received 500 kits that we will be stocking those kits. Just as we talked in yesterday's meeting, we may be able to hand those but we will be providing those for employees who are testing positive, or rather they are close contacts at work, and we will provide them with test kits at home. And those are all PCR tests. In other words, the results would be between 24 to 48 hours after the lab receives the samples from the employees. Next slide, please. Other choices that we will have, and we have, these choices are that employees actually can use their own health insurances, that they can log on to their websites and request testing through their health services. And another choice that they have is that they can go ahead and log on to lab websites. For example, Pixel is listed in this slide. They can log on to that site, and by providing their insurances, they will be receiving a test kit in the mail, and then they collect the sample, return it back to the lab, and the lab will take 24 to 48 hours to provide them with a result. And those are also PCR testing. In addition to the county and city free testing, that they're not really very good options at this time because of the spike that we're experiencing in the local area. The lines are incredibly long and growing longer. So that is not a very good option. Next slide, please.
You can jump in real fast, Azir. So real quickly, so what we're trying to accomplish with the testing, we all, I mean, I was in my office yesterday, I looked out the window, and Sunset Boulevard had a line a mile long getting into Dodger Stadium all day long through the rain, not to mention the longer line coming off the freeways from the other angle. And so, you know, we recognize that normally best available testing is really overwhelmed right now. And so we have this kind of multi-pronged approach. So first of all, testing has changed dramatically in terms of being able to access a test that you could administer yourself at home and have it covered by insurance. So for the average employee, we're trying to, and Joe will get to this in his communications plan at the end of this, but trying to make sure that employees understand their options because they're a way to get tests done quickly and get results quickly without having to go sit in line or expose yourself or leave your home necessarily. And that would be for any regular testing. At the same time, what Nazir described for our regular PCR testing with the fire department and the extra kits, that's 700 employees a week that we can test, that we can make available our own testing through our own means for them, as opposed to having to go and order a test on a website. And then you have the people who have potentially been in contact with someone with COVID at work, who we will give a test kit to or directly sign them up on a website to have a test kit delivered to their house or mail a test kit to make sure that someone who has particularly been exposed at work has a kit and a testing available to them. And then it's, you know, they can choose not to do it, but we're recommending that they do it in relation to their exposure at work. And then above and beyond that is this rapid testing that we're going to be using to canvass employees, particularly at the critical functions, to make sure that we don't have, it's just kind of it's an instant snapshot at that moment, but by doing it regularly, we hope that will set a kind of a baseline and catch problems before they get out of hand. So those are the level of testing. These are all in place. They're all, some have started. They are starting now, and by next week, I expect that all of them will be up and running fully. And of course, there's certain things that are already out there, and part of it's making our employees aware of that. I'm sorry, Nazir, didn't mean to jump in.
No, I'm glad you did. Thank you. I appreciate it. Next slide, please. Vaccination. We're working very closely with City of Los Angeles, Department of Emergency Management, as well as directly our chief physician working directly with County Department of Public Health. Department of Public Health will be in charge of distribution of vaccines. As of right now, the situations are changing depending on the delivery of vaccines to county. The situations are changing. As of right now, they have requested for us to compile a list of our employees based on the different tiers, based on the nature of work they're doing. and they are going to be tiered, and then the vaccine deliveries are going to be based on that list that we provide to them. The initial list is due December 31st, and the final list is going to be due January 7th. And tentative delivery time is sometimes towards the end of January, but that could very well change because of the difficulties that they may have for the receiving the vaccines. Dr. Israel can chime in on this for more information. I'm not sure if she has technical difficulties, but she can add any other comments on this.
Are you there?
Yes, I'm here.
Yeah, I would be interested in anything else that you can tell us. I am trying to understand exactly where our employees would line up in terms of the various tiers that they've been assigned to, and also, you know, what, if anything, well, I won't even say if anything. I'm interested in understanding that, and also interested in, so that we can take appropriate steps if necessary to advocate for advancing in the line.
There's several things that are going on at the same time. One is the decision of who's getting vaccinated is in the tier. Who is in a tier is not LADW's decision. It's going to be dictated by the city and others, by CDPH, California Department of Public Health and others, and local governance. Right now, I have seen and spoken with Marty and Nazir, with Mr. Adams and with Mr. Fosley regarding the tiers. And they're working with the city, the fire department, and others in ensuring that the essential workers are included. There's various tiers. So there was a few things on a slide. Maybe it's in the communications, but the utilities as a whole are also approaching this to ensure that their essential workers are getting vaccinated. It's a moving, and let me just also add, please, that the vaccines are not arriving as promptly as it hoped. So there's been delays in the dosing and numbers of vaccines that are reaching LA City.
No, we understand that. Yesterday there was a very big display of firefighters getting vaccinated, right, which was amazing and wonderful. So I think that my question is, what information do you have right now as to where department essential workers stack up or fit in the various tier process?
As of earlier this week, it was Tier 1, Phase 1, Tier B, or C.
And what does, and translate that for me, what does that mean? So in terms of, like, you know, phase... Deciding.
It's still up for grabs.
No, what is tier 1A, B, and C mean?
Okay,
is what I'm asking you.
Okay, I believe, okay, so that's fine. Tier 1A are the frontline hospital workers, okay, and the nursing homes, to be a blanket.
Mm-hmm.
So, and tier B and C, they are still looking at who is in that, but the essential workers, such as our utility folks, will be in that.
Okay, so Tier 1B, for instance, would follow, in theory, healthcare workers and workers, frontline healthcare workers, and people that are in nursing homes, just sort of that blend broadly. And then the next tier would be, or the next category, 1B, would be some combination of essential workforce still to be determined in terms of how broad that combination of people are. As you currently, because when you talk about essential workers, I mean, essential workers is a very broad category. Yeah. But as far as your understanding in terms of the conversations that you've been in thus far, you expect or understand that our utility essential workers are being thought to be in 1B or 1C.
That's correct.
Yeah, fair? Okay. All right, thank you.
And to clarify, Dr. was correct, and I know Nazir has been dealing with this also on a near daily basis. And as Nazir and I were discussing this morning, he said there's a lot of things that are in flux that are being decided now. As we develop our list for employee priorities, so and that is something that is the initial cut again, as he said.
I think that's pretty urgent, right?
It's very urgent, and of course, you recognize that they want a list by name, so there'll be eventually a list with 11,000 names on. And so, because we'll have to have all employees listed. As we do that, certainly in terms of priority listing, the ones that are the most critical to the operations, day-to-day operations, such as the same kind of people that we're rapid testing for, will float to the top. And then as we will be encouraging their decisions to make sure that those folks are included in 1B. I imagine that the large mass of employees may go to 1C, which would logically make sense, but we absolutely have people who need to be in 1B. And as we develop that list and they're identified, we'll be pushing to make sure. But again,
so that list will be developed by when? I mean, we're not talking about a universe of 5,000 people. We're talking about, you're talking about 400 people receiving rapid tests on a regular basis. So it's a relatively defined list.
We're talking the hundreds. There's a meeting after this board meeting where we'll be looking at what's been submitted already, doing a little reality check. And then
when you say what's been submitted, you mean submitted to whom?
The water and power systems that joint are submitting to Nazir their priority list.
So you mean what's been compiled already?
Right. They received.
Got it.
Right, and then we have to blend those together, and they'll and then so they'll be our first look at prioritizing, and then we'll be refining that through this week. And then by the end of next week, we have to have a final list available, and that'll have to include all.
I thought it was due at the end of the month.
January 7th, is it there? Is that right?
So that's the final list of January 7th, but we have to give them an initial list December 31st by 3 o'clock.
So we're working toward the initial list. That at least I think the most critical part of it'll float to the surface of folks who are the highest priority. I assume.
Well, this is December 29th, so I assume that we are pretty well on the way towards having that defined.
Yes, well, the systems that are contributing their priorities have been doing that since before Christmas, and so we've been gathering this information since last week when they asked for it, and then this is the first time we'll meet to discuss those pieces coming together. Because we have to submit one as a department, and so we have priorities from the different systems coming in now, that are in now. So we'll be merging that. We will have the preliminary list in 2 days, and then refining that and populating it with probably the bulk of employees to the end of next week.
Okay, thank you.
Next slide, please. This one is.
Our hand off to Joe.
I just have a couple of questions before we go to communications. Nazir, Marty, you mentioned that this transition from the COO's office to corporate safety was somewhat bumpy. And as you know, part of our interest in this area was triggered by, calls from our partners in labor. And I do want to acknowledge that they have been equally vigilant in and insistent that we are, and offered their assistance in helping to move forward a very robust plan to meet employee needs during this period. But, the rockiness of the transfer was noted. I know that as of a week ago, we had a significant backlog, both in terms of responding to employees and as it relates to contact tracing. So, Nazir, can you tell us where we are with respect to that?
Sure. I just received the latest information. As you know, we were really falling behind on returning phone calls and contact tracing. In my opinion, one of the most important things we can do to control the spread amongst employees, employee-to-employee transmission, is to quickly, rapidly identify close contacts and isolate them from workforce. So that is very important. And because of the number of calls, the number of positive cases, we were falling very much behind. In addition, the backlog of phone calls were reaching more than 2 days before the phone calls were being returned. So after discussing this with Marty and everyone else, we agreed that we need to add additional staff to resource office. We were able to add 10 additional bodies to assist with returning the calls, contact tracing, and helping our employees. The training was completed. I'm trying to read the final numbers. So as of 12/28, there was 107 outstanding calls. At one time, it was almost 400 calls, or actually it was 400 calls. So they are definitely working that down. And as of right now, we have, or as of 12/28, as of yesterday, we had 24 outstanding positive cases. At some point, that was well over 40 cases. They're working. There's a little bit of a learning curve here that they're working through, the training, but all of the members have already been trained, and we are expecting to be ahead of all these, or work through the backlogs today, tomorrow. That's my expectation. Yolanda, if you're here on the call, I know I saw your name, if you want to chime in.
Yolanda Mendo is one who heads up the resource group. Go ahead. Go ahead, Yolanda.
Good morning, I'm Yolanda Mendo. Yes, we've, as Nazir stated, we have worked through the weekend to get our new folks trained and on board with those that are more seasoned. And so we're working through the phone calls and through the positive cases and the contact tracing. We did get a little bit of a spike yesterday, which is typical of Mondays, to get an increase in phone calls and an increase in positive cases. And so we're going to continue to train and shadow our new folks. And as soon as we get those down, which I anticipate would be in the next couple of days, the average has been about 15 cases, 15 to 16 cases a day, and that should be manageable with the staff that I have on board now.
So I have a question. When you say 24 cases, is that 24 cases that require contact tracing? I'm just trying
yes,
to get so there are 24 cases in the queue that require you to begin contact tracing on.
That's correct.
Okay, thank you.
Yolanda, while you're on, Yolanda, do you want to describe what that work is, or the board understands what exactly your crew does?
As far as contact tracing, when we receive a phone call that an employee is positive, we have a staff member assigned to that case. They will do an intake interview with that positive employee and ask a series of standardized questions. If additional information is needed, we continue on with follow-up questions. At that point, we determine the paid administrative leave dates to put them off on their quarantine, on their isolation period, and give them instruction on how to return to work. We also communicate with the supervisor immediately after and let them know what the paid admin leave dates are, what we've instructed the employee to do and how to return to work, and then how to communicate with us if they have any further questions. A typical case can go for about, an easy case I would say is about 20 minutes, 15, 20 minutes. When an employee we've determined that there are close contacts in the workplace, that can go on for maybe an hour, a little over an hour, depending on if we can identify those contacts and contact them as well. So we have to contact the employee who's been exposed, as well as their supervisors. Some of these crews have different supervisors, so it gets a little bit complicated, and therefore the delay. Sometimes also positive employees don't call us back right away, or supervisors don't call us back right away, and that will cause a delay in our backlog.
Thank you.
And I know that your team has recently increased, so that, Nazir, you indicated that the operation, that additional resources were deployed in order to handle the rise in cases. I'm just curious. It sounds like we are now more right-sized than we were a week ago or so.
Very much so, yes. If I could add, correct me if I'm wrong, Yolanda, some of these cases, they have already been isolated, but they are outside the work cases, so there is really no contact tracing. Is that correct? The 24 cases, some of them are not at work exposures, so they are already isolating themselves, so the contact tracing is not that critical at work because they've never been at work during the exposure period.
That's correct. Many have been on modified telecommute or on a rotational work assignment, or other means that they've been home. And then, of course, supervisors have been advised, and as they call in, we do tell them, please make sure that those employees are immediately placed out, as well as anybody they feel was a close contact to that positive employee. And giving them the definition of close contact, 6 feet within 15 minutes over a 24-hour period. So by the time we call them, they've probably put out more than necessary, and then we'll continue to do the contact tracing and confirm that, and then we either bring employees back to work or keep those that need to be out, and confirm that with the supervisor and the employee.
Okay, terrific. I'm just looking at the clock, and I had promised that this meeting would not go long. So I appreciate this. I did want to make sure that we had time for a brief closed session, and so I know we have another presentation. I just wanted to make sure, are there commissioners that have questions regarding this presentation before we move to the next?
Can I make a final comment if I may?
Absolutely.
So first of all, I want to thank you for having the board meeting and for the commission's interest in this, because certainly, you're correct. The bumpy turnover was because the timing of transitioning hit exactly with the surge and the surge that Nazir and Yolanda just talked about, kind of overwhelming the staff that we had because it was such a dramatic increase in cases all of a sudden. So I think this caused us to reconfigure how we are addressing this, plus add a tremendous level of testing capability and roll out testing directly to our employees that we really have not done in the past. And so I think we are right-sized and poised to be able to handle, what we see coming at us for, the next several months. And I expect by next week that everything will be fully operational. And Joe can talk about his teams and how that seems in with this as well.
Perfect. Thank you. I'm sorry?
I do have a question, and it has to do with the extended family. When you're, it might have been mentioned, it may be obvious, but, we're all going through it. What happens with the, when we test and somebody has a significant other mate and adult children? Is everybody tested or just the employee?
Well, Nazir or Linda, do you want me to handle that? You have that.
So if I understood the question correctly, so if employees at home, some member of their family test positive, and employee is exposed, so the employee will be instructed to test themselves, and obviously anybody else who's in the household, they have to be tested. Now, they do have this testing available for employees' dependents through their insurance companies. In California, they are covered for free testing for employees' dependents. So anybody in a household, if there's positive, we instruct our employees to test themselves, and if they are not, if they test negative, of course, they have to isolate themselves when they can, but they have to be quarantined for 14 days, and then for an isolation period after that. So for
I
employees,
think, Cynthia, the question is, what steps are we taking, assuming that, an employee is, that we identify a positive case with an employee, that employee is now going home and their entire family is exposed. What steps, if any, are we taking to assist that employee with, tests for their family members?
So, we'll see this on Joe's rollout, but this is where, fortunately for us, because we have, very good insurance policies, that the simplest thing for families is to access the carrier that they have through the department and have a home test delivered to them to do at home. There's always a possibility, if there's someone who isn't covered, that we could send tests out from our stockpile that we would have. The normal path would be to utilize the resources that we're trying to help employees to not stay in a Dodger Stadium line or something like that, but to access home tests that can be delivered to the home. And they are available as one of the websites in the Zoo Show with Pixel. That's one of several companies that will also provide the test and then back bill the insurance. And in California has pretty good laws covering that testing is covered by insurance, not only our carriers but other carriers. And so, and that's particularly if you have symptoms or direct exposure, as opposed to just testing because I want to test. If you have direct exposure or symptoms, that all insurance are required to provide for recovering that testing. And so our role that we're working on, and Joe will communicate, is how we're trying to help employees access that so they don't feel that their only thing is to go wait in line for 4 hours, so that they have something that they can do conveniently at home, that we can help them understand what their options are and make those more available to them.
Okay, well, maybe we should see Joe's presentation, because I think that's part of, again, if people are, Commissioner Lear is absolutely 100% right. This is being experienced as an entire family event. It's not just an individual event. So that would be helpful. Commissioner Lear, did you have additional questions, or are you interested to see what Joe has to offer before additional questions?
No, yes, I'm fine.
Okay. Joe.
Good morning, Commissioners. Can you hear me okay?
Absolutely. Thank you.
Great. And then I think, Reggie, if you could pull up the presentation. Very good. And then that next slide, Reggie, thank you. I wanted to just briefly give you an overview of the existing communications to employees and how information is being shared. As many of you know, there's GM bulletins that go out regularly with information via email. The general manager has also done numerous videos. They've been very effective, very well received and watched. We typically, on the general manager's videos, get between 3,000 and 4,000 views within just the first 12 to 18 hours afterward. Obviously, that doesn't reflect our full workforce, but it is a significant number for the type of communications that we're doing and the interest in it. Overall, about half of our workforce ultimately typically would have viewed those videos. We've also done newsletters. Earlier in the pandemic, we were doing weekly newsletters. We would anticipate, as we move forward and with what I'll show you in the next slides, doing that more frequently again to share information, working hand in hand with Nazir and his team to identify what the operational needs are that need to be communicated to our employees. Also, the vast majority of information that's disseminated to employees finds its way to an existing intranet page and site. And that intranet site, if you could flip to the next slide, Reggie.
It is not the easiest to find. I'll acknowledge that. These pages for the department on our My DWP intranet page, they're built on an older platform. These pages are always maintained by divisions specifically and not by corporate communications. But in this instance, we're proposing a joint process of really helping to manage the information posting and flow and the platform that we're going to use, given the significance of this issue and the significant uptick that we've seen in cases in November and December, and the operating plans that Nazir and his team have for needing to communicate more frequently with our employees about things like testing or sharing information about our health plans and their coverage of tests, et cetera. Next slide, Reggie. The most significant obstacle to our intranet page right now is all of the information is located behind a wall that requires network credentials to access. So that, as you can imagine, that makes it very difficult for field employees, practically for many, it's actually impossible to reach this information unless they're in a workplace where they're using a common computer, which we're not supposed to do during COVID, to log in and receive information. It's not accessible, it's not user-friendly for a significant portion of our workforce. And so what we want to do, and if you could flip to the next slides, Reggie, and then the next one, this is the corporate health and safety homepage, for example. And this is the layout currently on our intranet page of this information. Again, it's not graphic, it's not engaging, and unfortunately, because of the password protected nature of it, it's not very accessible. I'll go ahead into the next slide, Reg. Thank you, and the next. Okay. What we've done just since last week, where we were really asked to focus on how could we help with communications for employees, is we've gone ahead and designed a publicly facing web page that's not uncommon for businesses right now in COVID. There's nothing really that we're sharing with our employees that's of a confidential nature. If it was, we wouldn't put it on this site. But we want to be very accessible both to the employees or, for example, if an employee is sick or in the hospital, to a family member to be able to reach this page. The platform that we're using is Constant Contact. And this is a page, as I said, that is really under development. We've, through my team, we've laid out sort of the basics of it right now, and we're going to work with Nazir to populate it with all of that information from the intranet site that we want to share here. The nice thing about this site is it is a responsive site. That means that you can view it on an iPad, an iPhone, or a computer very easily, scroll through the information. It's all vertically, organized. Go ahead and scroll to the next page, next slide, Reg. And the images I'm showing you are really what amount to a vertical scroll. Here's a message from the general manager about the purpose of the page and its importance. Go ahead, Reggie, next slide. We'll have, these boxes are organized in a way where you can get to the GM videos easily. You can get the latest information on testing as we get that information and help Nazir publish it, as well as the basic guidelines for workplace safety published by the Public Health Authority, LA County Public Health. Next slide, Reg. We're going to work with the team to focus the materials around, what's needed for a field worker so that they can click here. The way our current intranet site is organized, you really have to sift through, dozens of posts in order to find what's applicable to you. So we want to help people navigate to it and really have a more positive and easy user experience. So we want to organize that for resources for our field workers, office workers, facility managers, supervisors, and managers. In the instance where an employee calls you and says, look, I tested positive, what do I do? We need our managers or supervisors to have one place where they can go to get the protocol for how you refer that person to the resource office, what your role as a manager is, the type of paid administrative leave that they're placed on, all of that. So we're going to work with Nazir and his team. We've preliminarily reviewed this design with him and organized that information on here in a more easily accessible way. Next slide, Reggie. Again, this is a public site, accessible to anyone. There's another very nice feature of Constant Contact, which many of you are probably familiar with because most people don't even know that it's a website, but that is it's easy to generate newsletters. And you can link to info pages in those email communications to your employees. And you can also do this, I'll show you in a moment, via text using a function and a service that the department has that's been used on a very limited basis. You can either pre-populate or ask people to join the mailing list. What we envision with this site initially is going out and encouraging people to sign up for it, but we also are going to pre-populate it with at least all of the MEA managers' information so that they're getting it and able to push it out to their employees. There will be some intentional duplication of communications efforts as we go forward, and really a side-by-side. People are used to getting employee general manager bulletins. They're used to getting information distributed via email through the department. We will likely, for a period of time, while people get used to the new site, double up in sharing information via those GM bulletins and information through our traditional channels and through this next site. Reggie, can you go to the next slide, please? And what I'm saying is these are the types of newsletters that we're able to generate from this site very easily. We can send this out directly to people who sign up, or that we pre-populate, and we can take this newsletter and send it out through our existing email system. So those are the methods that we'll use initially as we get more people hopefully wanting to log in and sign up to get these newsletters. Family members could sign up to get this newsletter as well. It doesn't just have to be employees. And Reggie, next slide, please. We very much want to work to use the Nixle platform. Everbridge is a company that does really a lot of emergency notification services for employers to employees. A version of that used to be a separate company was called Nixle. It was used a lot by law enforcement. Everbridge bought Nixle, and Nixle allows you to either load in numbers, cell phone numbers, or have people sign up to get text notifications. As we work with Nazir to identify what his needs are, we'd like to invite employees to sign up to just get text notices that we put out. For example, we can put safety messages that go out once or twice a day saying, hey, remember, maintain social distance, wash your hands, use sanitizer. We could do that. We can also share specific links to information. The department, click here for the latest on how your health plan, covers testing, or basically link to the information that's on the intranet webpage that we're building out. Or if there's testing needs at a particular facility and we have 200, you're going to manage signups, you can send out a text to people that says, click here to get information about testing that's coming to your yard or field facility. Testing's available in Northridge Tuesday 2 to 4. Click here to sign up. Those are the kinds of ways we can support the operating needs of corporate safety to help, using technology to reach our employees. Our field employees right now, as I mentioned, it is not easy for them to get department information, that's posted on the intranet or even that's shared in general manager bulletins. We have in the past, and for every other purpose, we attach PDFs, they get posted and placed in a workplace. But as with COVID, with encouraging more and more mobile reporting, not congregating in a yard, we need to be able to take the information to the employees more directly. Between this site, between the email blasts that we can send out from it that are much more engaging and useful, and the text notification, we would propose that we would be able to more effectively reach people. The website itself, we anticipate having ready this week with a launch no later than next Monday. The text notification process, we need to work through with the systems, with Nazir, to identify what the operating needs are. For example, I was hearing earlier that it may be more complex how we distribute 400 tests in a day. Maybe we gather all that information and their work cell phone numbers, get people's permission to text their personal cell if they want to offer us that personal cell to text them, and then load it into the system. So there will be a natural sort of a period here where we need to work out how to get the text notification up and running most effectively. But when we ask people to sign up for getting emails through the site, we will also ask them for permission to text them general information. They may also receive more specific information if we need to target it in a way that is sort of targeting to a direct yard or a field facility. That's the presentation, and I'd be happy to answer any questions that you have.
I don't have any questions about this. Thank you. I'm pleased to see our standing up a system that will allow us to be more effective and to provide more timely communications to employees. I do know, or I guess I have a question. Are we coordinating our efforts in this regard with IBEW as well? You mentioned MEA. I'm interested in any coordination with IBEW.
Yes, I spoke with two of the reps yesterday about our intention here and the purpose of it. They were very encouraged, and we also talked through the text notification process and ensuring that you get people's permission to text their personal phone. But they seemed very much encouraged by the effort. They understood the importance of trying to get information more effectively to employees and how challenging that can be, and also recognized that it's oftentimes easier to get a text and to follow a link than it is to check your email, which we just know our field employees are not as inclined to do because they're out in the field. They're working, remotely, and checking email, isn't something that they just do as a part of their day necessarily. So it was very well received, and we did have that very good, productive conversation yesterday.
Well, that's great. I look forward to seeing the site go up and registering to get emails and texts. So I will be interested and one of the first adopters next week. Are there any additional questions from commissioners?
I'm wondering, some of us have actually been listening to information on headphones. If you're in the car and you're moving around like some of your staff does, and perhaps not the more, if this kind of information that you're speaking to right now, but if you want to describe, for example, the different kinds of testing, I tried to take notes from everything. It is really confusing. And it's not your fault. I mean, fortunately, there's options, right? But if you were to want to focus and you're traveling for work because you're working out in the field, is there a way, either way, both in the form of a newsletter or in the form of and maybe things are changing so fast that it's almost impossible to do, and this is the best way to do it. But I'm just thinking of as for those of us who listen and then absorb and then try to look at what all the options, it just seems that there is some possibility of mixing the media, how you use it to help people understand not just the instant information, but also the complexity and all the pieces of information. I actually was taking notes and then started using colors to underline who's responsible and what tests there are. And by the time I was like, okay, it's like really, and because you also have different levels of sort of workers with different kind of level of education or sophistication, or even just personality types, where, I have people who have master's degrees and are working in our firm who are basically paralyzed. Mm-hmm. Yeah, they can't, they're so overwhelmed and confused by the options and the situation that they're, So there's a psychological, and then sort of an and then there's the ability to give people information that's digestible. So I know that this is a great effort, and I just would have you in the next few weeks think of ways that you can both capture it in a way that if people want to read it or look at it and try to understand the whole picture at once, where do they go for that?
And I think, Commissioner, one of our goals in partnering with Nazir and his team is to try to make this digestible, as you said, understandable. I'll give you an example. Just since last Friday, we laid out all of Thomas Simonoski from HR Health Plan sent us all the information for all the plans about testing and the rules and what's available. And we laid that out graphically in a way that I didn't have a chance to get it into this deck because it was just completed this morning, but I will email it to each of you so you can see the type of materials that we're able to develop and help simplify, because it is complex. It's a lot. And our hope, too, with the intranet site is to make it easier to find stuff that applies to you and to break it down in a more simplified way. So we're going to learn a lot as we go with this, and I think this is hopefully will immediately provide some improvement, especially as far as just accessibility. But we're going to learn and adjust as we go to making it also digestible and understandable and responsive to the needs that people have for information about all of it.
I also want to point out the importance of the role of the managers and supervisors in communicating all of this content, all of this information that we have, so that then it becomes more relatable to the people that they supervise, that this information is important, and not just saying, look at the website. But they have their regular meetings. I assume that's happening virtually, that this communication should be communicated and prioritized, especially now that we have all these resources that we're providing to our employees. So I would just like to emphasize the importance of the communication coming from our own managers and supervisors to their employees, in addition to the communications program and resources that the DOS team is offering.
Thank you.
Cynthia, you're muted.
Sorry, I was saying thank you. And is there anything else that either commissioners or others would like to offer? Then it seems like we are good with this part of the meeting. Do we need a motion to adjourn, or are we, I'm sorry, we are simply adjourning our open session and moving into closed session. Joe, is there something that, Brevich, I assume there's something that you need to do?
Yes, at this point we will recess and go into closed session, and in accordance with California Government Code Section 54957.1, we will report any final actions taken therein. Commissioners, you have a separate call-in number for the closed session. At this point, we are in recess.
Thank you.